A chronic illness is permanent or lasts a long time. It may get slowly worse over time. It may lead to death, or it may finally go away. It may cause permanent changes to the body. It will certainly affect the person's quality of life. In this program, COPD, chronic obstructive pulmonary disease, which includes emphysema and bronchitis, will be discussed. COPD refers to a variety of disorders which are associated with an abnormal inflammatory response of the lungs to noxious particles and gases. This reaction causes obstruction, air trapping in the alveoli, and impaired exhalation. About 8.6 million Americans have been diagnosed with COPD. Each year, there are over 8 million outpatient consultations, 1.5 million emergency department visits, and 726,000 hospitalizations related to this disorder. COPD is the fourth leading cause of death of adults in the United States. The two most common manifestations of COPD are emphysema and chronic bronchitis. COPD can be precipitated by many irritants. Cigarette smoke is the most common and accounts for 80 to 90% of the cases. In addition, frequent exposure to air pollutants such as industrial fumes, aerosol sprays, non-tobacco smoke, and internal combustion engine exhaust also precipitate this illness. People with asthma, untreated TB, or frequent respiratory infections are also at risk for its development. Genetics may play a role as well. Some individuals with COPD have a deficiency in alpha-1 antitrypsin. This is a protein that is manufactured in the liver. It travels via the circulatory system to the lungs, where it protects them from the destructive actions of common respiratory illnesses and exposures, particularly tobacco smoke. People with this abnormality are prone to develop premature emphysema, as the elastin fibers within the lungs are destroyed. COPD primarily affects the lower airways. It is often manifested as a combination of emphysema and chronic bronchitis. Emphysema, which usually appears after age 60, can be caused by an overproduction of the enzyme elastase, one of the immune system's infection-fighting biochemicals. This leads to irreversible destruction of the walls of the alveoli. As they rupture, the number of alveoli is reduced, and those remaining become enlarged, making the lungs overinflate and less elastic. Obstruction of airflow can also precipitate distension distal to the blockage. There are three types of emphysema. Centriacinar, which affects the bronchioles and central portions of the upper lobes. Panacinar, which is related to alpha-1 antitrypsin deficiency and involves the alveoli and bronchioles in the lower lobes. And distal acinar, that results from scarring of the alveolar ducts and sacs. Furthermore, there are several clinical classifications. Compensatory emphysema, in which the alveoli are not destroyed. Diffuse emphysema, type A, or dry emphysema, in which prognosis is good. And diffuse emphysema type B, or wet emphysema, where prognosis is poor. Chronic bronchitis is associated with an increase in the size and number of goblet cells, which leads to excessive mucus secretion. At the same time, cilia are damaged, and smooth muscle hyperplasia, inflammation, and bronchial wall thickening occur. All of these pathologic changes restrict airflow and necessitate higher pressures to force air out of the alveoli. This, in turn, can lead to the collapse of the bronchioles during exhalation, trapping stale air inside. The prognosis of the disease is affected by age, smoking status, resting heart rate, and airway responsiveness, as well as if there are concurrent medical conditions such as hypoxemia, pulmonary hypertension, cor pulmonale, or congestive heart failure. Unfortunately, by the time an individual with COPD is symptomatic, he has lost between 50 and 70% of his lung function.
What brings you in today, Mr. Chapman?
I really haven't been feeling well lately.
What's been going on?
I seem to have developed this cough like the last few weeks or a month, and it really has made me short of breath.
All right, is there anything else?
Yeah, I have been tired a lot, and I have a real tightness in my chest, and it's almost like I need to take a nap almost every afternoon. And I've been losing weight, almost 10 pounds this month. I haven't even really been trying.
Okay, well, let me start by looking and listening to your chest.
The chest may appear barrel-like due to hyperinflation. On auscultation, prolonged expiration, wheezing, or decreased breath sounds may be heard. Heart sounds may be distant. In addition, hyperresonance may be heard on percussion. Later signs of emphysema include increased respiratory rate, which is proportional to the degree of disease severity, use of accessory muscles, cyanosis, and peripheral edema. The symptoms of chronic bronchitis can be somewhat different than emphysema.
Tell me how you've been feeling.
Well, I have this cough, and it's really bad in the morning. That's when I cough up a lot of mucus, and it's been getting worse.
Do you have a lot of colds and respiratory infections?
Yeah.
Chronic bronchitis is associated with frequent infections, such as acute bronchitis and pneumonia. On auscultation, rhonchi or wheezing may be heard. There may also be concurrent cor pulmonale, which is associated with cyanosis, or right-sided heart failure, which may produce edema. Diagnosis of COPD is made using pulmonary function tests and chest X-ray. Emphysema will illustrate a small heart and flat diaphragm, while chronic bronchitis will show increased bronchial markings. An EKG may be done to rule out right ventricular hypertrophy. Blood samples also can be analyzed. An ABG can assess for hypoxemia and pH, and hemoglobin and hematocrit are done to evaluate for polycythemia. COPD, whether emphysema or chronic bronchitis, can have tremendous effect on an individual, as respiratory insufficiency can impact work, family obligations, and leisure, as well as activities of daily living.